Welcome back everyone, it's Comics Canines. Today we'll be discussing a fun topic, and that is canine anatomy. During this series we'll be explaining the many parts of a dog's body, the functions of each part, and basically just how a dog's body works. So this video does not go on for hours. I will break it down into 3 separate videos as there is a lot to cover. So we'll first be doing the head, then the body, and lastly the tail and legs. So without further ado, let us get into the video. To start this video, we will discuss the different sections on the head with the canine anatomy, a dog's head. We have the eyebrows, or the vibrissae, the forehead, the eyes, the stop, the nose, the muzzle, the whiskers, which we will discuss further soon, the flue, also known as the lip, the cheeks, the ears, the mouth, and the teeth. Now, we do also have the neck, the crest, the nape, the occiput, and the throat. Now do take into account we'll be discussing the external parts of the dog, so the neck and the 7 cervical vertebrae. The function of the neck is to support the head and protect the spinal cord. A gentle S-curve allows the head to be arched upwards and backwards. This allows the head to be held facing the direction of movement, then also allowing forward flexing to reach the ground to sniff and eat. We have the normal arched neck, the short neck, and the U-neck. A normal arched neck. The neck's top line starts at the junction of the skull, continuing with a slight curve called the arc, and blends smoothly into laid-back shoulders. A neck should be in proportion to the balance of the animal. It should be strong and long enough, allowing the head to be carried in its proper position, and the neck that joins smoothly into laid-back shoulders will exhibit a faultless appearance. The short neck. The neck that is set onto steep shoulders will be short and out of proportion. The short neck will appear stuffy, blocky, and often covered with heavy, short, thick muscles with no elegance. A throaty neck has loose skin in the dewlap and generally accompanies the short neck. The U-neck. The U-neck is concave on the neckline without an indication of an arch, and it abruptly joins the shoulders and back. The circumference of the neck is usually equal from top to bottom, and the U-neck lacks muscle and support. Each breed has a different type of neck associated with the breed's type of working ability. Next up is the crest. Now, the crest starts at the nape and ends at the withers. It doesn't have a vital function, but the multiple muscles, ligaments, and bones under the dermis do. Now, the nape. The nape of the dog's neck is where the neck joins the base of the skull in the back of the head. Next, the occiput, commonly referred to as a knowledge bump, knowledge knot, or a wisdom bump. It was once thought to be an indication of a dog's intelligence. This bump is more prominent on some breeds compared to others. The occiput is a natural part of a dog's anatomy and has a vital function. The primary purpose is to protect the bones of a dog's skull and brain. Predators would often try destroying a dog's skull, so the more protection the skull had, the higher chance of survival. Another function is to serve to assist a dog's head movement in relation to the spine. The occiput bump also has several nerve endings, so some people who study canine therapeutic massage and acupuncture believe this bump deserves extra attention. The eyebrows. Now, dogs technically have 2 types of eyebrows. They have whiskers called vibrissae, and they have what looks like human eyebrows, which are controlled by muscles which are thought to have been evolved to communicate with humans. But we're here to talk about the vibrissae whiskers. Now, the reason dogs don't have human-like eyebrows is simply they don't need to. Humans have eyebrows to reroute sweat, among other things. Dogs do not sweat, well, not like us. Dogs do have some sweat glands, but they operate different. So dogs' eyebrows are vibrissae. Like the other whiskers on their face, these have a practical purpose. These whiskers provide dogs with sensory information pertaining to location. When something rubs against these whiskers, they vibrate, making them work sort of like antennas, relaying information to the dog's brain. Such examples, these whiskers can determine if a dog can fit through tight spaces without risk, and these vibrissae help protect a dog's eyes, as dogs' eyes are vulnerable to being poked and injured, which could lead to things like corneal abrasion. And one last function for these is to detect which direction the wind is blowing, which aids a dog when using their scent to follow prey. The forehead. The forehead or brain case is the portion of the dog's head that's similar to your own forehead. It goes from the stop and eyebrows to the back point of the skull. The stop. The stop is an indentation, sometimes non-existent, between the muzzle and the braincase or forehead. The muzzle. The muzzle, or foreface, is comprised of the upper or lower jaw. The whiskers. Unlike regular hairs, whiskers do not cover the entire body. They are strategically placed above the eyes, which we discussed already, on the chin, and above the upper lip. Whiskers are coarser and thicker than regular hair, and the roots are 3 times deeper. Whiskers are more sensitive than regular hairs because the follicles from which they originate are packed with blood vessels and nerves. Dogs' whiskers are as sensitive as a human's fingertip, so while a human's sense of touch is our fingers, a dog's is their face. A dog's face is accentuated by his whiskers, but whiskers are more than simple facial enhancements. They serve an important function. They are specifically tuned sensory equipment that guide a dog through daily activities. These specialized hairs aid vision and help a dog navigate their environment by providing additional sensory input like an antenna. These whiskers are called tactical hairs, but in reality they don't actually feel anything. They simply transmit information to sensory cells when detecting an object or movements. They can also detect subtle changes in the air and shape, speed and size of nearby objects, basically helping to navigate the world. Whiskers are basically radar sensors. They can also help convey emotion and are protectors to dirt, dust and dangers. But these whiskers also need protection. Almost 40% of the brain's sensory area aligns with parts of the body that have whiskers. The flew, or also known as the lip. The flew is a fancy name for the dog's lips. It includes the skin that hangs over the muzzle. The flew can show certain signs and signals of stress. There are overt signs and signals that we've learned to look for in dogs to determine stress levels. The cheeks. The cheeks are the skin along the side of the muzzle, about where your cheeks are if you had a muzzle. The throat. The dog's throat anatomy is quite similar to yours. You're familiar with the terms like trachea, larynx, epiglottis, and esophagus. Your dog has them, and they share the same function as ours. The trachea, or windpipe, is a tube consisting of a flexible C-shaped cartilage rings. Air passes through the tube en route to the bronchi, then onto the bronchioles, which are smaller airways than lungs. The larynx, which is your dog's voice box. This sits atop the trachea. It serves along with the epiglottis as tracheal protection. The larynx consists of cartilage, muscle and ligaments kept in place by the hypoid apparatus, which also supports the tongue and pharynx. The dog's epiglottis, on top of their larynx, acts as a gatekeeper. It keeps food from entering the larynx and the windpipe when the dog swallows. Shaped like a leaf, the epiglottis moves over the entrance to the larynx once swallowing commences. The canine esophagus sits alongside the trachea, beginning as part of the pharynx. It's a tube that moves food from its initial point to the stomach, with virtually no absorption of eaten material. Sphincters on either end of the esophagus aid in transferring food to its destination with no harm to the other parts of the throat's anatomy. Now that we're nearing the end of the video, this is where it's going to get fun, interesting, and we're going to dive deep. The mouth. The mouth contains jaws, teeth, tongue, and salivary glands. The jaw's purpose is to hold the teeth for grasping and tearing food. The salivary glands secrete saliva to lubricate food for swallowing. The tongue helps guide food to the back of the mouth and throat, and for licking water and for small pieces of food. Dogs have an organ on the roof of their mouth which assists in tasting smells. This organ, called and sorry if I get this wrong, the vomeronasal organ. It is forbidden on the roof of the mouth behind the incisors. The organ has a small opening into the mouth. The dog can detect pheromones and various scents in the air. Once these scents of pheromones are detected, a neurological signal is passed to the olfactory center into the limbic system, specific structures within the brain which are responsible for emotions, behaviors, memory, processing, and motivations. Although smell and taste are intricately linked, taste buds and taste is greatly reduced. Consider what some dogs eat. They'll eat grass, yet refuse vegetables. Dogs will eat horse manure, and yet a T-bone the next day. Dogs have approximately 1/6 of the taste buds humans have. Their sense of taste is limited, although they can taste sweet and salty and bitter and sour. Taste buds are not dispersed over the tongue's surface. They are all clustered at the front of the tongue. The nose. The dog's nose, they are renowned for having an acute sense of smell, or called olfaction. They can detect and differentiate between extremely low levels of odour. The two nostrils lead to the nasal cavity. The nasal cavity contains ethotubinate bones lined with olfactory receptor cells. These receptors are in the olfactory epithelium, which has a large supply of olfactory nerves that connect to the olfactory lobe within the dog's brain. A lot of olfactory. So in addition to scent processing via the vomonasal organ and the receptor cell of the nostrils, molecules in the air which meet the dog's nose will dissolve on the moist surface of the nose. This moisture is secreted from a mucus gland in the nasal cavity. Again, molecules are detected by receptor cells, and signals are carried from receptor cells to the olfactory center of the brain. The olfactory center of the brain is called the olfactory bulb. The olfactory center is approximately 40 times larger than it is in humans. The close association of the olfactory bulb and the structures of limbic systems are to us to understand the relation between smelling certain odors or scents and the recollection of specific memories, e.g. of people or places or even other dogs. Dogs use sniffing to increase identification of odors. This is different to their regular breathing, as they are using short, rapid inhalations and exhalations to force air into the olfactory epithelium. The teeth. The dog's teeth play an important part in the biting, tearing and grinding of foods. Dogs have 3 types of teeth with specific purposes. First, the incisors. These are the sharp cutting teeth at the front of the mouth. Second is the canines, the conical pointed teeth used for ripping. And third, the molars and the premolars, the blunt, irregularly shaped teeth used to grind food smaller. The carnivorous nature of dogs has influenced the arrangement of teeth, the dentation of them. While young dogs will have temporary teeth, these erupt around 3 to 4 weeks of age, and they begin to be replaced by permanent teeth at about 4 months. Ears. The ear is divided into 3 main parts: the external, the middle, and the inner ear. The external ear consists of the pinna, or the ear flap, and external auditory canal. The pinna is made of cartilage and both sides are covered with skin. Dogs can move their ears by using small muscles, but this is only possible with prick ear breeds such as the German Shepherd or semi-prick ear breeds such as some of the terrier breeds. Doing this, they can pick up and locate the direction of sound, but floppy ear breeds such as the Spaniels, this isn't possible. Floppy ear breeds also suffer more from ear disease compared to the prick-eared breeds. The external auditory canal is made and lined with modified skins of intubement. This canal is divided into 2 parts: a long vertical portion directed upwards and a short horizontal section that ends at the eardrum. The ear canal in dogs is much deeper than humans. This ear canal allows dogs to hear 4 times better than humans. They can also hear in 600th of a second. The middle ear is found within the tympanic cavity of the temporal bone of the skull. It is separated from the external ear by the tympanic membrane or eardrum. The ear vibrations are picked up from eardrum by a chain of 3 small bones called auditory ossicles. The largest is called the malleus. It is attached to eardrums and it transmits vibrations to the second ossicle or incus, which is contacted with the 3rd ossicle or the stapes. This is the smallest bone in a dog's body at 2 millimeters length and contacts the inner ear by the way of the oval or the vestibular window. This way, sound waves collected by the pinna are conducted to the eardrum by ear canal and is transmitted by ossicles to inner ear. Linking the middle ear to the throat is a short canal called, and I'm sorry if I mispronounced this, the Eustachian tube, which helps equalize pressure on both sides of the eardrum. The inner ear is the most complicated part of the ear. It consists of many fluid-filled channels and sacs. It is divided into 3 parts, namely the cochlea, the vestibule, and the semicircular canals. Inside the cochlea, sound vibrations are converted into nerve impulses by the organ of Corti. These travel via the cochlear nerve to auditory centres of the brain and enables dogs to hear sounds. This vestibule and the semicircular canals are involved with maintaining balance. Disease of the inner ear is rare, but deafness in newborn pups may be due to failure of the cochlea to develop. In older dogs, it may be due to degeneration of the organ of Corti. Eyes. The eye is a complex structure compared to a camera. It is built around a light-sensitive living film, the retina. When light lands on this, signals transmit to the brain via optic nerves, which enables dogs to see. Light first enters through the pupil. The amount of light entering the eye is regulated by movement of the eyelids and pupil, with focusing being achieved by the combined action of the transparent front of the eye, or the cornea, and the lenses. The lens of the eye is a biconvex structure shaped like an oval. This lens is attached to the eye by exceptionally fine fibres of ligament. One end of the lens, the fibres join the ciliary body, controlled by the ciliary muscle. Ciliary muscles produces fluid known as aqueous, which nourishes the lens and cornea. This fluid drains back through ciliary body and helps maintain correct shape of the eye. The disease of ciliary body may result in glaucoma. The structure that regulates the size of the pupil is called the iris, and it is a ring of coloured muscle. The tough white part of the eye is known as sclera, and it is covered by a delicate membrane called conjunctiva. The space behind the lens and in front of the retina is filled with a transparent jelly called, I'm sorry if I get this wrong, vitreous. The retina itself is nourished by a tissue called, once again, sorry if I get this one wrong, choroid, which is found between the retina and the sclera. Dogs also have reflective layers in the eye, which magnifies incoming light. This reflective layer is called tapetum lucidum, which gives dogs blue or green shine when the light is hit at night. And that is the anatomy of the external parts of the dog's head or cranium. Thank you for joining us. If you did like this, please make sure to leave a comment, like, and subscribe to the channel for more to come. I had an absolute blast making this, did a lot of research, learned some things myself that I didn't already know, and I hope you did as well. Make sure to go check our website, our Instagram, our Facebook, and everywhere else that we are on all socials. Thank you for joining us. This has been Comics Canines. It was an absolute pleasure. We can't wait to see you in the next video, which we'll be doing for the anatomy series, but also we'll have another episode of the cooking, and the documentary first season will be posted soon. Thank you everybody. Comics Canines out.